Donning. Step 1 to dresser 1. Place on overshoes over your own footwear. If double gloving, place on inner gloves. Step 2 to dresser 1. Put on surgical gown and tie to the side. Pay attention to the collar and cuffs. If wearing a suit, step into the suit and zip up fully. Pay attention to the collar and cuff. If double gloving, place on outer gloves. Ensure outer gloves go over BizTech suit. Place on plastic apron, ensure it is tied to the rear. You can utilise the buddy system if needed. Step 4. Place on FFP3 mask or droplet mask, ensuring a tight seal. Place face shield onto head, ensuring a comfortable fit. If wearing a suit, lift the hood over the rear of the face shield, ensuring a comfortable and snug fit. Step 6. In the buddy system, please check each other. Make sure there are no rips to the suit and gloves and no skin is showing. It is appropriate to allow the wearer to expose the ears if required to aid with patient assessment and communication. Doffing. Step 1. Step into box A and remove any gross contamination seen. Use Clinell wipes in the following order: gloves, apron, visor, gloves. Step 2. Step forward into box B and face the clinical waste bin. Step 3. Pull apron from the top and fold in on itself. Pull from the waste and place into clinical waste bin. Step 4. Use hand sanitizer to sanitize outer gloves. Step 5. Remove outer gloves in aseptic method. Pull cuff down over thumb, inverting the gloves, and place in clinical waste bin. Step 6. Now use hand sanitizer to sanitize inner gloves. Step 7. If wearing a surgical gown, take each arm out of the gown, folding the gown in on itself to the front. Ensure the innermost surface of the suit is outermost and place in the clinical waste bin. If wearing a suit, unzip the suit fully and remove in the same way. Roll down the hood, pulling from the rear and turn inside out. Roll suit to the ankles with the innermost part of the suit outermost. Stop at the ankles and remove hands by inverting the sleeves. Step 8. Remove overshoes, touching the innermost part of the PPE and place in the clinical waste bin. If wearing the suit, remove the suit and overshoes in one motion and dispose in the same way. Step 9. Use alcohol gel to sanitize inner gloves. Step 10. Remove the face shield, holding the lugs at the side of the shield and drop into the clinical waste bin. Step 11. Use alcohol gel to sanitize inner gloves. Step 12. Lean over the bin. Remove FFP3 or respirator droplet mask by pulling the strap from the rear. Drop into the clinical waste bin. Note, please do not touch the front of the mask as this will be heavily contaminated. Step 13. Remove inner gloves in the same method as outer gloves in an aseptic fashion. Step 14. Use Clinell wipes or hand sanitizer gel to sanitize hands. You can also wipe the face if you feel this is appropriate but not essential for COVID decon. Wipe from the inside out and changing wipes regularly. Step 15. You are now clear to leave the safe undressing lane. Step 16. Safe undressing officer. Carefully remove apron as shown in video and place in the clinical waste bin. Sanitize gloves. And remove respirator or droplet mask. Carefully remove gloves in the aseptic fashion. Please remove all clinical waste bags and swan neck. Remove to the clinical refuge area. Sanitize hands before leaving safe undressing area.